Hello everyone, and welcome to the TRAKnet demo that's being provided to you by the owners and consultants of Nemo Health, a company dedicated to the professional advancement of your podiatry practice. Before we get started with this demo, I want to just go over a little bit about who Nemo Health is, as well as some of the important features that I want you to pay attention to as Dr. Bass provides the live TRAKnet demo for us. Nemo Health represents far more than just an electronic health record. We're actually a full-scale practice improvement company that has a number of technologies designed to help our colleagues and fellow podiatrists improve their podiatry practice. These practice improvement strategies occur through the use of Nemo Health's suite of technologies. That includes the TRAKnet electronic health record, which is the EHR used by more podiatrists than any other. Then we have the Nemo Billing, which is a full-scale podiatric-specific medical billing company to which many podiatrists outsource their billing to. This strategy allows you to have podiatric-specific billing experts take over the complex process of billing so that you could generate more revenue and save on your billing costs. We also have an e-commerce technology integrated into TRAKnet. Think of DocShop Pro as the Amazon of medical supplies. We all know that medical supplies are probably the second or third most costly component of running your medical practice. Well, we've leveraged the purchasing power of over 2,000 TRAKnet users to negotiate much better pricing from the very vendors you're currently likely using right now. And now with DocShop Pro, our users not only have the ability to save money, but also save time, since they can order all of their medical supplies from the vendors through one efficient portal. And wrapped up inside of TRAKnet and included in our very cost-efficient pricing is built-in consulting. Our team of podiatric consultants can help guide you to build a better practice. You'll become more efficient. We can assure your compliance and even guide you right through the MIPS process to protect you from getting expensive penalties. So you should watch for all of these features as Dr. Bass provides this demo, and seriously think about jumping on board to one of the easiest to learn electronic health records that's used by more of your colleagues than any other technology. You're going to see how TRAKnet contains a fully integrated charting, scheduling, e-prescribing, and practice management platform. Our users have the option of either hosting the TRAKnet application on their local server or having it in the very secure Microsoft Azure cloud. We're very proud of the fact that we've received the most up-to-date ONC certification for electronic health records. TRAKnet contains a robust practice management reporting platform that allows you to thoroughly understand your practice and provide you with the insight for better management. It also comes complete with a vast variety of podiatric-specific templates, which have been designed through our user leadership team of podiatric experts. That's why our software's workflow is so specific to podiatry. TRAKnet even has on-the-fly adjustable user interfaces so that physicians can elect to see only the things that are pertinent to their tasks, while the front desk and medical assistants have other interface options so that they can simply see what's relevant to them, all with a simple click. But we go way beyond being just an electronic health record vendor. As your colleagues, we truly want to see your practice thrive. We provide monthly educational webinars, newsletters, weekly blogs, all designed to help you and your staff improve your practice. One of the most unique features of TRAKnet is the on-demand consulting that's included in the cost-effective price. With a click of a button, you can have all of your questions answered regarding MIPS, coding, practice management, HIPAA, and many other topics, all by our team of consulting experts. Another very unique feature is the fact that we focus on your compliance during this time of escalating government audits. TRAKnet has a feature that provides our users with real-time data on their utilization comparatively to 2,000 other TRAKnets of their top CPT codes. That will enlighten you as to whether you're an overutilizer or an underutilizer of those codes. It can certainly help prevent situations that trigger an audit. All of these are the reasons that we are proud to state that we care about your entire practice and we're not just simply your electronic health record vendor. So now I'm going to turn this over to Dr. Bass, who's going to provide us with a live demo so that you can see TRAKnet. Alan, please take over as I make you the presenter.
Thank you, John. I appreciate the opportunity to show everybody the TRAKnet practice management and charting platform. When you log into your TRAKnet application, you will come here to a blank screen, which is your patient chart. Beginning on our scheduler, I'd like to demonstrate some of the robust features that you will see within our scheduling platform. This platform is completely customizable as it pertains to all of your patients' scheduling needs. The only feature that we ask you to decide ahead of time is the interval in which you like to schedule your patients. In this case, you'll notice that my TRAKnet is set up with a 15-minute interval here. So taking some time to schedule some patients, let's just show you a little bit about how this platform works. We could very easily take this 10-15 appointment time and add in a patient. We can very easily just choose a test patient. It will then give you the opportunity to choose any type of reason. You can see that my platform is defaulted to the existing patient at a 15-minute interval. So very easily, if I just now click save, you will notice that Andrew Test comes in. And you could also notice that if the appointment is scheduled at a time after, it will alert you immediately that that patient has missed their appointment. If we now go and schedule an appointment after the current time, we'll take another test patient. And we will see that you can start with the existing patient, or very easily, if you go down to anything you'd like, and this is a completely customizable area for not only time, but color, you can see that I've now scheduled Barbara Test for an ingrown toenail procedure. Very easy, just by a quick visualization of your schedule to know exactly what you have in regards to the types of patients that day. We also have the ability to do some other scheduling here for you to go to outside facilities and schedule those patients just a little bit differently. So let's choose that 12 o'clock time slot and now click add, but we're going to add a facility visit. We can now choose which facility that you would like to go to. You can also designate it as the reason that you're going to a facility. Now you can also choose the length of time that you're going to be at that facility. You'll notice now that there's no area here to choose your patient, because we're going to be able to do your recall list. If we click on patients, and we now see that we're scheduling myself in my Brookside facility, I'm going to click my recalls. It allows me to specifically choose which facility, which is now Brookside. You could choose a number of days and diagnoses. You could be that specific, and you can click search. You now see that I have these 3 patients scheduled. It would tell me the last encounter date, the total number of days that would be when that patient was seen last. Just by simply holding the control button on your keyboard, you can very easily schedule multiple patients at once. Very simply, you could see they drop in to the schedule. If you need to select any specific patient that doesn't come up in the recall list, you could then add them by clicking select patient. And once you click save, you will see that that facility time has been scheduled out for those 2 hours from 12 to 2. And by simply clicking and highlighting, you're also going to see the patients that are on your schedule for that moment in time. Let me also add one additional patient to show you some other very good features of TRAKnet that you can do directly from your schedule to make life very, very simple. We're going to put Alan Test onto our schedule as an existing patient, and I'm going to now highlight that person's name to show you some other very good features of TRAKnet that are completely integrated within TRAKnet. One of the things that is integrated is integrated credit card processing. You very easily can take your credit card payments directly through the TRAKnet platform, which would allow you to not utilize an additional phone line or even credit card terminal in order to take payments for copays or anything else related to your patient. You could see in this demonstration that Alan Test has a $10 copay on a regular basis. If we were to click on that $10 copay, which is part of Alan Test's profile, what happens is you have the ability to take that payment in any way you'd like and save it directly into the patient's invoice for that given day and not have to have double data entry, entering it in one place and then entering in another place. In speaking directly about credit card integration, by clicking on credit card, you will notice that the integrated credit card processing window opens, and you would have a small swipe that could be very easily Velcroed to your front desk screen, that where you would swipe the credit card, the information would be populated here, you would click submit, and the processing is actually done not in TRAKnet, but on your banking side. That allows you to continue to remain PCI or banking compliant because you are not storing your patient's credit card information in TRAKnet. You also do have the ability to very simply type in the information in this area in order to allow patients to call and give you that information over the phone. You can still submit it here at the same way. What would then happen? You could then very easily print the receipt and click save. And what would then happen is this would gray out, indicating that the copay had been paid. Another great feature that you can do directly from your patient's chart and do it directly from the schedule is you can notice that every patient can have a red light, yellow light, or green light right next to their name. And what that would indicate is about their integrated insurance eligibility. You with TRAKnet have the ability to do a complete batch eligibility by clicking on this button, which would run the eligibility for all of your patients on your schedule at a moment in time. So by running it early in the morning, you would know right away if any patient's information does not match up from TRAKnet into your clearinghouse, TriZetto, and their information comes directly from the insurance companies. So if there's any problems, you would know that ahead of time. By clicking on the eligibility button for Alan Test, it would take you directly into Alan Test's profile. What happens is it opens up and checks the information directly that we have. Across the top here, for any real patients that you would have buttons here indicating the copay, the coinsurance, the deductible, the out-of-pocket expenses, all in real time. It would also check whether or not patients have coverages for durable medical equipment or any other indications here. This is information that is given directly from your insurance company to TriZetto. The software is just a pass-through. All of the information that we get is directly from the clearinghouse. So whatever information they get, we can get. Now, while we don't get information down to the specific things such as coding, it would give you the indication right off the bat whether or not a patient even has coverage for other things that might be needed. And this is done all in real time. Again, our schedule is completely customizable, giving you the ability to block off days, block off times. And all of this information would be given to you during your training sessions. Again, the addition of all appointment types is done here. I'm going to add in one other patient, and now we're going to jump into utilizing the TRAKnet platform itself. So I'm going to scroll down, and I added in a brand new patient known as Robert Test. And the reason I did that is I wanted to make certain that we have all nice, clean information for me to demonstrate all of the features of TRAKnet. So by highlighting Robert Test, we're going to just then click and highlight on the blue hyperlink, which takes us directly into Robert Test's chart. And now we're in the patient's chart within TRAKnet. You can see that on the left-hand side, you have the ability on this menu to actually, at all times, without needing to go into your schedule, have a view of all of the patients on your schedule for that given day. If that is something that you don't want to see when you're in the chart, again, showing the customizing of TRAKnet, you can hide that menu to actually give you some more screen real estate. Let's just talk a little bit about the patient's chart before we get into the actual documentation. You can see that a lot of the information that we have across the top, the side, and the bottom is pretty straightforward to any patient's chart within most electronic health records programs. Very easily adding in a patient's demographics, scanning, giving you the ability to scan documentation, scan a patient's insurance card, scan a patient's driver's license to become completely paperless, quickly generating a patient statement if they need. Clicking on medications and allergies will give you the ability to do medication reconciliation. Now you're going to see that we're going to do some medication reconciliation from here in the patient's chart. You can also do it from this area where we're going to cover, known as your patient's dashboard. You can list all of your patient's problems and diagnoses ahead of time. If there are any problems and diagnoses that a patient has, you can utilize what is known as our Smartsheet 10 technology to give you the ability to search through a Smartsheet, which we have, which you can build for your common podiatric diagnoses, or actually search the entire ICD-10 library, which is completely up to date and live and has everything you need at any given time. You can e-prescribe directly from the patient's chart. You'll also be able to e-prescribe directly from an encounter for that patient by simply e-prescribing. By clicking on the button would give you all of the prescriptions that you have written for that patient, and then very easily go on to click prescribe and have the ability to now search for any medication that you need to. By clicking the add button would give you the ability to choose from a favorites list, or to now also choose from LexiComp to search for anything. By going next, it also will tell you immediately whether or not you have any eligibility for that patient when it comes to their pharmacy benefits. It'll pick up again your favorites, or searching for any medication that you would like. Going forward, you would then put in your quantity, your diagnosis, your directions, and forward it on to the pharmacy. You have the ability to add any type of an alert to this patient. So anytime that patient is queried, whether that patient calls for an appointment, you have the ability to set an alert that would allow the person on the phone with that patient to communicate whatever that alert might be, whether it's an outstanding balance or anything that is necessary for that patient when you query that patient. You have a place to house your documentation just on hemoglobin A1C. Our users suggested to us that they wanted a place to just look at information specific to that for their diabetic patients, and we have the ability to do that. Again, there are many buttons throughout the entire chart here that we would go through with your training session. What I'd like to do is focus on this central area and these tabs across the screen here. We're going to leave workspace for the end because it is the most unique customizable area within TRAKnet. Clicking on the All Documents tab would have the ability for a quick view of any documents that are in a patient's chart. All the documents would be listed here with a View button to very easily take a look at any document you may want in regards to the patient's chart. You have a multimedia folder. You will start with a very basic set of folders that would be in all of your patient's chart, and you have the ability to add and customize all folders that you have within TRAKnet. Your billing tab. Everything that you ever wanted to know about billing for your patients is housed under that billing tab. Their insurance, any authorizations that are needed, the ledger, generating any statements, all found here under the billing tab. The appointments tab, you have the ability to make a patient appointment directly from their chart. This was a feature that our users suggested to us. While we always have the ability to click on our scheduler, when we first developed TRAKnet, we did not have an ability to schedule an appointment directly from the chart. Due to user feedback through our idea wall, we heard from our users that they wanted this feature. They have the ability to put features on the idea wall, which our 2,000 users will vote on. And if they are voted on with enough votes, then that is something we will integrate within our program. We base our development on user feedback. All of your progress notes will be housed here, just specific to the progress notes, not every document which would have been found here. If you don't want to make an encounter in regards to a phone call with a patient or some inter-office messaging about a specific patient, those can be done and housed right here. All of your secure messaging through the patient's portal would be found and housed here. And for our users who have been utilizing TRAKnet in an older form, all of a patient's TRAKnet encounters in our old TRAKnet 2.0 platform would be found here. Let's focus back on our workspace. Our workspace leads to the dashboards. The dashboards are set up and can be customized for all of the employees within the practice. Everybody can have a dashboard that is unique to their job description. You could see that for myself, as the physician, I look at information that I want to see on a physician's dashboard. When the biller logs in, if they're just doing billing, they have the ability to look at just billing information. There's no need for them to log in and have to look at clinical information, but they do have the ability to access it. But they can look at the billing information right away. Your front desk has the ability to just look at front desk information, can be customized to put anything that they want to see that would make their job more efficient. Your medical assistant can have information on their dashboard that you want them to take specific to their job description. We also have a MIPS dashboard, a place, a repository of information where a user can indicate whether or not the MIPS information for your patients has been taken on a specific date. So let's go back to the physician dashboard and let's put in some information about Mr. Test. You could see that his visit reason, if we click on the HPI or the history of present illness, you could see that you will be given a list of specific podiatric specific complaints. You could utilize any one of these, let's say such as heel pain. where it would drop in a mini template. This area also has the ability for you to free type anything specific that you would like for that patient. Utilizing this mini template by clicking on the hyperlink, that's the first one, what happens is it opens up the choices that can be made for that specific link. Very simply, by clicking on the right heel, it will load it in and change the color, indicating you've answered it. Now, instead of having to click to open up each individual choice across the board, by simply pressing on the tab keyboard on your keyboard, it will very easily open up all of the different choices and find them until you're done. So in this case, this person had some heel pain that's been aching. It's been going on for several weeks. It started suddenly. It's been getting worse. Oh, it hurts the most when exercising. And previously, they have had a cortisone injection. And you can see now all of the different choices for this different mini template in regards to heel pain have been answered. Once we click save, you can see that it drops into the physician dashboard. Now, remembering that that was a link that we clicked on to open up, anytime a link is populated in TRAKnet, that link will populate any place else you'll find that link. So to show you that if the medical assistant was in the treatment room asking the question, they also had the HPI link that's there. To show you a little bit more in depth on how that works, so remember, you see we have a medications link on the medical assistant dashboard. We also have a medications link on the physician dashboard. Let's make believe your medical assistant was bringing Robert Test into the room and was clicking on the medications to do their medication reconciliation. So you want to add some medications, you can search from a list of favorites. You can click on Lexicomp and search for a list. Or for your real patients, you have the ability to click on their pharmacy benefits, which will send out a ping to their pharmacy benefits manager, and any prescriptions that were filled within their pharmacy through their pharmacy benefits, not as a cash prescription, will show up here. You have the ability to highlight them and add them to the patient's medication history. For demonstration purposes, we're going to give this patient some atenolol in their medication history. And once we add it to there and we close it, you can see that it has become part of their medication history. We're going to also give this patient some allergies. So we'll give them an allergy to ampicillin and add that to their history and close it. Once we close this, you can see that it has added the medications and allergies to the patient's history on the medical assistant dashboard. Let's also add in some medical history. Let's give Robert some asthma as a medical history. Let's also give him some other surgical history. So you could see that this information was put in by your medical assistant. If the physician is sitting in their office waiting to go and see that patient and wants to review the dashboard, by clicking on the physician dashboard, having the same links, you can see that this information automatically populates to the physician dashboard. Let's start an encounter and let's show you a little bit about the charting platform. Clicking on a new encounter for Robert brings you to our screen where you will be starting your encounter. You have the ability to copy any old visits to create a new visit. What is unique about TRAKnet is by copying an old visit to create a new visit is completely customizable. You can bring over not only their charting, which could have all of the links that would need to be changed, and in order for you not to have the quote canned note that auditors look for, all of the links are still completely active and no physical typing would be needed unless you want to. When copying a note, you also have the ability to copy any previous diagnosis or CPT codes. You can bring over any or all of those that might be needed as well. Before you copy those notes, you'll also be able to view whether or not any of the old encounters might be relevant. They would be listed here with a view button and would show up here. You'll notice that once you get TRAKnet, you will get a robust set of templates. You can categorize them in any way, shape, or form that you would like here, giving them any category you want. Your list of templates, a very robust series of templates that you can use or not use as you'd see fit. TRAKnet was written on the Microsoft platform, so very easily you could take templates just as you would have a Word document and very easily copy and paste them in to create any template that you would like. Let's show you what those links that you previously used on a patient's dashboard can actually do to help you do your charting. By clicking on, let's say, a new SOAP template, and we're going to start a new visit, you can see that the patient's history of present illness, their allergies, medications, medical history, and surgical history will pre-populate my note for me. And why does it do that? Because my template is built on a series of links. Just to show you what that looks like, by clicking the Actions button and clicking on Editing the Template, you'll see those same links that were on my dashboard appear in my note. Remember that the links, once they're populated once, will show up anywhere they are again. Coming down, you could very easily populate any links that haven't been populated. A review of systems. You could very easily see that you could create multiple types of reviews of systems, whatever you'd like. By clicking on a review of systems, you can list your review of systems and then, as needed, change any one of them as needed. Dropping them in your note, you could see it populates very easily. Coming down to the objectives. If you click on the objective, you could see that you can have a series of mini templates that are relevant to that problem that you would want to use. They are all broken down by body systems. You could see with a very simple indenting of the title, giving it one space, that would actually rise it to the top of your list for very easy access. So if you would click on a link such as my normal vascular exam, you can see that it will populate here, but with all those different links are completely customizable. If we continue to scroll, and we come down here, and let's say we were talking about heel pain and want to do an orthopedic exam, and we're going to put in our plantar fascial palpation. You can see that the links that come up here would very easily be able to click on any links that you'd like, and these are customizable as needed. Coming over to what I think is our most unique feature, very simply, we showed you early to reconcile our history that the patient will come in, but adding our diagnoses. Let's click on any problems. You'll notice that it opens up again to our Smartsheet technology. Our Smartsheet technology, or your electronic super bill, you have the ability with some very simple clicks to add those diagnoses to that encounter for that given day. You'll notice that some of them are green and some of them are white. The green ones show a one-to-one relationship between your ICD-9 and ICD-10 codes. So if somebody had onychomycosis, very easy, we'll add into the active problems for their history and their visit problems for that given day. To show you the uniqueness of Smartsheet and how smart it is, I'm going to go down and utilize what I like to show a lot of times is fracture coding. By utilizing Now, fracture coding, I'm going to click on the unspecified fracture of a metatarsal. It now opens up our entire library of ICD-10 codes directly to the unspecified metatarsal fracture code. Now, you can notice that it actually shows it up in red. We try to make things visual, showing you red, stop, that code will get denied. But if you very easily come down, for example, to a fracture of a third metatarsal bone, it opens up all of the different coding that could be associated with the third metatarsal fracture. It also knows immediately by clicking on a displaced fracture of a third metatarsal whether or not that coding requires a seventh character. By clicking on that seventh character, you will see that it becomes green, and it knows that that is a good code for you to use. By clicking on select, drops into the patient's active problems and their visit problems. The smart sheet can be completely set up, customized for your needs, and for anybody else within the practice. You can have smart sheets for anybody that you would like. By clicking on save, it will come back into my notes. You'll also notice that this new patient has a office visit level 3 code built in. That's because I want that there. By doing that, I have my coding, my CPT coding built in for a 9.9 level code, or the new visit code. You can very easily do some other very unique things, while you also have your plan mini templates that you very easily can drop things in. I'd like to show you some unique features of TRAKnet. You can have it built in where you can very easily type a specific code, such as an injection code. What it will do, it will automatically bring up the verbiage that's associated with it. I will show you in a moment, by typing that code, not only did it bring up a template, but it also did your billing for you. Some other things that you can do with TRAKnet, if you're unfamiliar with your coding, but know the procedure you performed. So for instance, let's go down to surgical, and let's see that you did a matrixectomy. Well, you know what you did, but you're not sure of the coding. You can actually build into TRAKnet the code and then the template behind it. So if you focus your attention right here as I click matrixectomy, you're going to notice that a code is going to appear, but then also the template behind it is going to appear. You see, by clicking on matrixectomy, it did my template, and right before that showed up, you saw the code associated with it. Now you have to set that up ahead of time, but once you do that, by clicking on your invoice screen, you're going to know what's happening. Now, TRAKnet is now saving all the codes that you did. You'll notice that my embedded coding for my new office visit showed up on my template. You will notice that the code that I typed for my injection showed up on my invoice. You'll also notice that the word associated with a matrixectomy went to a code, which went to a template, and now appeared on my invoice. You still have the ability to add in anything by clicking on the plus, which you can come over to your favorites list, or you can have a super bill built where you can add in anything else that you would like. At this point, you would be able to very simply double click on a line and add in any diagnoses or modifiers that are needed and have them in there. You also have a history of any specific claims that were done with any time frame that you would like to look at as well. The diagnoses that were associated with that will show up here. The patient's insurance will also show up at the bottom if you need to rearrange for whatever reason is there. Adding in coding that is specific to over-the-counter products can very easily have you choose something that would allow you to add it to your invoice, but not go out on your claim, and make it a patient responsible charge. Through here, you have the ability to look at some details of the claim. You have the ability right through our invoice to split claims and send claims to different insurances for different locations, such as home or office. TRAKnet will do a check of your claim to see if you have any mistakes associated with the claim. It will give you any history of that claim if it's been a previously submitted history and you want to see. For all of your claims, you have the ability now to look at their MIPS information. TRAKnet is intuitive, and it knows, based on a patient's age and CPT code, whether or not that patient qualifies as a denominator to have any reporting done for that patient. At this point, it's very simple for you to click Bill Ready and to now submit that claim by signing and closing it. And that takes us through the very high-level look of TRAKnet from a charting standpoint. I'm going to close my chart right now and take you through some other features that TRAKnet had that Dr. Guiliana spoke about earlier. Through our links, you have the ability to go to DocShop Pro, which is our e-commerce unit, and will allow you to do all of your purchasing right from DocShop Pro. Some of the other links in DocShop Pro, as I spoke about earlier, is our suggestions forum. If you have a thought that you would like with TRAKnet, you think it would be something that's good, you have the ability to put it onto our idea wall. Some other areas that you have here, you could look at your different reports that are here, plus our robust reporting platform, which is on the side as our billing platform. The other feature that Dr. Guiliana spoke about is our code audit compliance. Clicking on our code audit compliance allows you to open up and see how you compare to other TRAKnet users on your utilization of codes. And lastly, on-the-fly consulting. If you have any questions that you need help with, whether it was HIPAA, whether it was charting, whether it was billing, whether it was MIPS, you have the ability through our consulting, through our Nemo Nurture website, in order to ask any questions immediately. If you have any additional questions, first I'd like to say thank you to all of you for paying attention to this webinar. And if you have any questions at this point, I'd like for you to reach out to sales@nemohealth.com, where they can very easily answer any of your questions that you have. Thank you for your attention to this webinar and this presentation, and have a very pleasant day. Thank you.